Ectopic pregnancy. Definition. An ectopic pregnancy is one in which the fertilized ovum is implanted and develops outside the normal endometrial cavity. Site of implantation. Mainly divided into two. Extrauterine, uterine, extrauterine. It is further divided into three. Tubal most common 97%. Ampulla 55%. Isthmus 25%. Infundibulum 18%. Interstitial 2%. Ovarian 0.5%. Abdominal 1%. Primary, secondary, intraperitoneal, extraperitoneal, uterine, further divided into four. Cervical less than 1%. Angular, cornual, caesarean less than 1%. Early signs and symptoms. Missed period. A missed period is often the first sign of an ectopic pregnancy. Abdominal pain. Mild to severe abdominal pain, often on one side, can occur. Vaginal bleeding. Light to heavy vaginal bleeding, often accompanied by abdominal pain. Nausea and vomiting, morning sickness-like symptoms. Fatigue, feeling weak and tired. Advanced signs and symptoms. Severe abdominal pain, sudden, severe abdominal pain, often accompanied by vomiting. Rupture symptoms, sudden, severe abdominal pain, followed by fainting, dizziness, or shock. Shoulder pain, referred pain in the shoulder or neck due to internal bleeding. Dizziness and fainting, decreased blood pressure due to internal bleeding. Tachycardia, rapid heart rate. Other possible symptoms. Urinary frequency, increased urination due to pressure on the bladder. Constipation, decreased bowel movements due to pressure on the intestines. Diarrhea, increased bowel movements due to hormonal changes. Risk factor, major risk factor, moderate risk factor, minor risk factor. Major risk factor, previous ectopic pregnancy. History of ectopic pregnancy increases the risk of another ectopic pregnancy. Pelvic inflammatory disease PID, especially if caused by chlamydia or gonorrhea, increases the risk of ectopic pregnancy. Tubal surgery, surgery on the fallopian tubes, such as tubal ligation or reversal, increases the risk of ectopic pregnancy. Infertility, women with infertility issues, especially those undergoing fertility treatments, are at higher risk of ectopic pregnancy. Smoking increases the risk of ectopic pregnancy, especially in women under 35 years. Moderate risk factor, previous pelvic surgery, surgery on the uterus, cervix, or ovaries increases the risk of ectopic pregnancy. Endometriosis, women with endometriosis are at higher risk of ectopic pregnancy. Uterine abnormalities, women with uterine abnormalities, such as an uncornuate uterus, are at higher risk of ectopic pregnancy. Family history, women with a family history of ectopic pregnancy are at higher risk. Minor risk factor, age, women over 35 years are at slightly higher risk of ectopic pregnancy. Multiple pregnancies, women who have had multiple pregnancies are at slightly higher risk of ectopic pregnancy. Intrauterine device IUD use, women using an IUD are at slightly higher risk of ectopic pregnancy. Assisted reproductive technology ART, women undergoing ART, such as IVF, are at slightly higher risk of ectopic pregnancy. Extrauterine, it is further divided into three. Tubal most common 97%. Ampulla 55%. Isthmus 25%. Infundibulum 18%. Interstitial 2%. Ovarian 0.5%. Abdominal 1%. Primary, secondary, intraperitoneal, extraperitoneal, extrauterine tubal ectopic pregnancy. Ampulla, isthmus, infundibulum, interstitial, ampulla, occurs in the ampulla, the widest part of the fallopian tube. This is the most common type of tubal ectopic pregnancy. Isthmus, occurs in the isthmus, the narrowest part of the fallopian tube. Infundibulum, a type of tubal ectopic pregnancy that occurs in the infundibulum, which is the funnel-shaped distal end of the fallopian tube that opens into the peritoneal cavity. Interstitial, occurs in the interstitial portion of the fallopian tube, which is the part that passes through the uterine wall. Extrauterine ovarian ectopic pregnancy, a type of ectopic pregnancy that occurs when a fertilized ovum implants in the ovary, outside the uterus. Extrauterine abdominal ectopic pregnancy, primary, secondary, intraperitoneal, extraperitoneal, primary. A type of ectopic pregnancy that occurs when a fertilized ovum implants directly in the abdominal cavity, outside the uterus and fallopian tubes, without any evidence of tubal rupture or implantation. Secondary. A type of ectopic pregnancy that occurs when a fertilized ovum initially implants in the fallopian tube and then ruptures or implants in the abdominal cavity, resulting in an ectopic pregnancy in the abdominal cavity. Intraperitoneal, a type of ectopic pregnancy that occurs when a fertilized ovum initially implants in the fallopian tube and then ruptures into the peritoneal cavity, resulting in an ectopic pregnancy that implants on the surface of an organ or structure within the peritoneal cavity, such as the bowel, liver, or spleen. Extraperitoneal, a type of ectopic pregnancy that occurs when a fertilized ovum initially implants in the fallopian tube and then ruptures into the retroperitoneal space, resulting in an ectopic pregnancy that implants on the surface of an organ or structure outside the peritoneal cavity, such as the kidney, ureter, or pelvic sidewall. Uterine, further divided into four: cervical, less than 1%; angular, cornual, caesarean, less than 1%.
Cervical ectopic pregnancy, a type of ectopic pregnancy that occurs when a fertilized ovum implants in the cervix, which is the lower part of the uterus that opens into the vagina. Angular ectopic pregnancy, a type of ectopic pregnancy that occurs when a fertilized ovum implants in the angular region of the uterus, which is the area where the fallopian tube meets the uterus. Cornal ectopic pregnancy, a type of ectopic pregnancy that occurs when a fertilized ovum implants in the cornal region of the uterus, which is the area where the fallopian tube meets the uterus but is located more laterally. Caesarean scar ectopic pregnancy, a type of ectopic pregnancy that occurs when a fertilized ovum implants in the scar tissue of a previous caesarean section. This type of pregnancy is also known as a scar pregnancy. Causes: Tubal factors. 1. Tubal damage. Damage to the fallopian tubes due to pelvic inflammatory disease (PID) surgery, or endometriosis. 2. Tubal obstruction. Blockage of the fallopian tubes due to PID, endometriosis, or adhesions. 3. Tubal anomalies. Congenital or acquired anomalies of the fallopian tubes, such as tubal diverticula. Ovarian factors. 1. Ovarian anomalies. Congenital or acquired anomalies of the ovary. 2. Ovarian cysts. Presence of ovarian cysts or tumors. Uterine factor. 1. Uterine anomalies. Congenital or acquired anomalies of the uterus, such as a unicornuate uterus. 2. Uterine surgery. History of uterine surgery, such as a cesarean section. Other factors. 1. Assisted reproductive technology (ART), use of ART, such as in vitro fertilization (IVF). 2. Previous ectopic pregnancy. History of previous ectopic pregnancy. 3. Smoking. Smoking increases the risk of ectopic pregnancy. 4. Pelvic surgery. History of pelvic surgery, such as tubal ligation or hysterectomy. 5. Intrauterine device (IUD) use. Use of an IUD increases the risk of ectopic pregnancy. Diagnostic test for ectopic pregnancy. Laboratory tests. 1. Beta-HCG. Beta-HCG levels. Elevated levels can indicate pregnancy, but not necessarily ectopic pregnancy. 2. Progesterone levels. Low levels can indicate an abnormal pregnancy. 3. Complete blood count (CBC) to rule out other conditions, such as infection or bleeding disorders. Imaging studies. 1. Transvaginal ultrasound (TVUS) to visualize the uterus, fallopian tubes, and ovaries. 2. Transabdominal ultrasound to visualize the abdominal cavity and surrounding structures. 3. Doppler ultrasound to assess blood flow to the embryo. Other diagnostic tests. 1. Laparoscopy, a minimally invasive surgical procedure to visualize the pelvic cavity. 2. Culdocentesis, a procedure to check for blood in the cul-de-sac. 3. Urine pregnancy test (UPT) to confirm pregnancy. Diagnostic criteria. 1. Positive pregnancy test. Beta-HCG levels greater than 5 μ per milliliter. 2. Absence of intrauterine pregnancy. No visible embryo or yolk sac on ultrasound. 3. Adnexal mass. A mass visible on ultrasound, suggestive of an ectopic pregnancy. 4. Free fluid in the pelvis. Blood or fluid visible on ultrasound, suggestive of a ruptured ectopic pregnancy. Treatment of ectopic pregnancy. Medical management. 1. Methotrexate. 50 mg per square meter IM, single dose or multiple doses. 2. Expectant management. Close monitoring of cis-HCG levels and ultrasound. Surgical management. 1. Laparoscopy. Preferred method for diagnosis and treatment. 2. Laparotomy. Reserved for cases of rupture, severe bleeding, or failed laparoscopy. 3. Salpingectomy. Removal of the affected fallopian tube. 4. Salpingostomy. making an incision in the affected fallopian tube to remove the ectopic pregnancy. Surgical techniques. 1. Linear salpingostomy, a technique used to remove the ectopic pregnancy while preserving the fallopian tube. 2. Segmental resection, a technique used to remove a portion of the fallopian tube containing the ectopic pregnancy. 3. Fimbriectomy, a technique used to remove the fimbriae, the fringed ends of the fallopian tube, to prevent future ectopic pregnancies. Emergency surgery. 1. Ruptured ectopic pregnancy. Immediate surgery is necessary to stop the bleeding and remove the ectopic pregnancy. 2. Hemodynamic instability. Surgery may be necessary to stabilize the patient's vital signs. Nursing management. Assessment. 1. Vital signs. Monitor temperature, pulse, blood pressure, and respiratory rate. 2. Pain assessment. Evaluate the severity and location of pain using a pain scale, e.g., 0 to 10. 3. Abdominal assessment. Monitor for tenderness, guarding, and rebound tenderness. 4. Vaginal bleeding. Assess the amount and duration of bleeding. 5. Emotional assessment. Evaluate the patient's emotional state, including anxiety, fear, and grief. Nursing diagnosis. 1. Acute pain, related to ectopic pregnancy and surgical intervention. 2. Anxiety, related to condition. 3. Fear, related to potential loss of fertility and future pregnancy complications. 4. Grief, related to loss of pregnancy and potential emotional trauma. 5. Risk for infection, related to surgical intervention and potential for infection. Nursing interventions. 1. Pain management. Administer analgesics as prescribed and provide comfort measures, e.g., positioning, relaxation techniques. 2. Emotional support. Provide emotional support and counseling to address anxiety, fear, and grief. 3. Education. Educate the patient on the diagnosis, treatment, and follow-up care. 4. Monitoring. Continuously monitor vital signs, pain, and bleeding. 5. Wound care. Provide wound care and dressing changes as needed. 6. Infection prevention. Implement infection prevention measures, e.g., hand hygiene, sterile technique. 7. Follow-up care. Ensure follow-up appointments and provide instructions for post-operative care. Post-operative care. 1. Pain management. Continue pain management as prescribed. 2. Wound care. Provide wound care and dressing changes as needed. 3. Monitoring. Continuously monitor vital signs, pain, and bleeding. 4. Emotional support. Continue emotional support and counseling as needed. 5. Follow-up care. Ensure follow-up appointments and provide instructions for post-operative care. Complications. Hemorrhage. Monitor for signs of hemorrhage, e.g., hypotension, tachycardia. Infection. Monitor for signs of infection, e.g., fever, chills. Adhesions. Monitor for signs of adhesions, e.g., bowel obstruction. Future ectopic pregnancy. Educate the patient on the risk of future ectopic pregnancy. Prevention. Safe sex practices. Use condoms to prevent STIs. STI screening and treatment. Regular screening and treatment for STIs. Smoking cessation. Quit smoking to reduce risk. Healthy weight maintenance. Maintain a healthy weight. Effective contraception. Use effective contraception to prevent unintended pregnancy. Early detection and treatment. Early detection and treatment of ectopic pregnancy. Follow-up care.